Hi again, students. Welcome back to Economics Simplified with Favor. I'm so excited to have you watching. And if you're new to this channel, I'm Favor Olariwaju, and I'm the instructor for this economics introduction class. My videos are all about breaking down complex economic topics into simple concepts and showing the step-to-step calculation and walking you through the process so that the average person can understand what exactly it means in everyday life. So today we're going to be covering chapter 12 of the Gregory Mankiw textbook on Introduction to Microeconomics with the MICRO. And chapter 12 is simply on the economics of healthcare. So we have a basic understanding of what healthcare means, right? We want to make sure that we're all healthy at the end of the day. But what is the actual economics of it? How do we make sense of it in economics terms, right? So a few things to explain is some basic characteristics. First of all, there are three parties in the healthcare system. The buyers, who are also known as the patients or the household, we that demand for the healthcare services, and the suppliers, who are the healthcare providers, right? Those who go to medical school, the nurses, all of those that work in the healthcare system. And there's a third party known as the insurers, right? So either your health insurance or the government. So for instance, in some countries like England and Canada, the government is the one that foots all medical bills, right? So the people don't have to pay out of pocket for anything, right? So that is known as the single payer system. But in countries like United States, it's a split partnership between private entities and the government. So the government doesn't foot all the bills. The government only steps in to intervene and reduce the burden on the private companies. So as we know, all private companies have profit motive, right? So if the health insurance for the United States is left in the hands of private individuals alone, it's going to be way too costly to afford. And already we know that healthcare is very expensive, and this is another reason why the government steps in to intervene in different forms, such as the Affordable Care Act, the Medicare, which is for elderly people and disabled people above 65 years old, and then there's also the Medicaid for low-income earners, right, to be able to get access to affordable healthcare. And there's also one for veterans, right? So for those who have served in the army and all of that, they get some kind of discounts on their health insurance. Something else you should note is that patients have limited information. So there's something called information asymmetry, which simply means that patients do not know all that they want or they need. For instance, if you are sick as a patient, you have the flu, you have the allergies, you just know that you want to get better, right? But you don't know how to get better, you don't know how to go about it, which is why you go to the healthcare providers. So patients have information asymmetry, and this is where the healthcare providers step in to provide the necessary healthcare access. But how do the healthcare providers get paid? We, the patients, don't pay directly to the healthcare providers. We, the patients, pay through the third party, which is the insurers, right? So the health insurance, we pay on a monthly basis, yearly basis, however it is. And then the health insurance is the one that pays the money to the health providers. So what that tells you is that this isn't your regular scenario of market competition, right? So the allocation of resources are not as usual because it's not left to the market. Instead, it's based off on negotiation between the healthcare providers, the patients, and even the health insurance. And this comes with some form of positive or a negative externality depending on the scenario, and could lead to inefficiency if it's a negative externality. So for instance, when we talk about vaccines or flu shots, which doesn't just protect you, but it protects other people around you from getting infected with viruses or whatever the case may be, that is a positive externality as we learned in chapter 10. Also, research and development for medications and even medical technology is a positive externality because it benefits everyone as well. Moreover, things like subsidies and patents, which is used to preserve the intellectual prowess of those who come up with medical cures and treatments, is also beneficial to those around them, like the society at large. However, the negative externality is in the case of sicknesses, viral-borne diseases, it can spread out and cause a problem, right? And also to prevent the health insurance companies or the healthcare providers from taking advantage of the patients, there are different ways that the government can enforce healthcare quality and take care of any potential negative externalities. One of these ways is by certifying all health professionals. So for instance, except a health medical provider is not certified by the government, taking all the necessary exams, all those rigorous exams, and most of these exams you have to take it on a yearly basis or bi-yearly basis. You don't have to take it every couple of years to make sure that you are still fresh in the game and still certified and on top of your game. Another way the government can ensure good healthcare quality is through the Food and Drug Administration, which vets all pharmaceutical products to make sure that they pass the national standards. Then there's also accrediting medical school. So if you go to a WAC medical school or a school that doesn't have national recognition, then your license is questionable, right? And people will not want to risk their lives to, pay to see you or consult you for health services. And you could even get in trouble with the government if you're not properly accredited and certified. So these are ways in which the government ensures healthcare quality despite the potential negative externalities in the healthcare system. Apart from information asymmetry, there is also other market imperfections, such as being risk averse. Who is a risk averse person? Basically, someone who is less inclined to taking risk, right? So they prefer certainty over uncertainty. So on average, most people in society or in the world tend to be risk averse. They don't want to take extreme risk unless they are guaranteed of some sort of benefit from taking that risk. And this is where health insurance companies come in. So health insurance companies basically, it pulls the different risk categories of people and just gives like a flat rate of insurance fee or insurance premium. So for instance, one person might be more likely to get a particular disease, say diabetes, than another person, right? But the insurance companies have no way of knowing this except you disclose it to them. And most of the time, specialists don't disclose all of this sensitive information until they get to their healthcare provider. So right on the health insurance website or page, the health insurance can only work with what information you provide them, such as your age, just general information, right? And they just give a flat rate of insurance fee to cover both high and low risk people, both risk averse and risk loving people. So let's take a quick example. So for this first example, imagine that there's a soccer team and the risk of bone fracture is 20% for this soccer team, right? And this soccer team comprises of 25 players. And the treatment for treating one fracture is $21,000, right? But the probability of a risk of getting a fracture is 20%. So how many players are likely to get injured in a year, given this? So we have a 20% probability. So 20% times, how many players do you have? 25 players. And that's going to give you 5 players that are at risk of getting injured and fracturing their bone within any 1 year, right? So now we know that 5 players out of 25 players are at risk, given the 20% probability. How about part B? What is the total healthcare bill per year to cover the cost for the team? So again, we know that 5 players are at risk, and the cost per treating one fracture for the player is $21,000. So $21,000 times 5 players, that's going to give you $105,000 total cost for the team. Okay, how about the average healthcare cost per person? So if it's going to cost the team $105,000 to treat 5 players on average in a year, how much is it going to cost per person? That is going to simply be $105,000 divided by the 25 players, and that is going to give you $4,200 per person. So basically, since it's going to cost each person on average $4,200 in the whole year to pay for their health insurance, what the insurance company does is, it's as good as keeping each person donate or keeps this $4,200 in a safe place, which is a health insurance company, right? Pays on a yearly basis just to protect against the risk of a low incident, right? It's very less likely that you will get fractured, but it could happen. And when it gets happen, it's a lot of money, right? Therefore, each person in this team is better off paying this amount to the insurance company on a yearly basis, right? If they decide to pay less than this amount to the insurance company, it's not going to cover the cost of treatment, right? So it has to be at least this amount. And again, so that depends on the probability of risk, the amount of the treatment, and of course, the number of players, and of course, whatever the health insurance company is offering. Moving on to the next imperfection of healthcare markets. We talked about information asymmetry already, which is when the buyers don't have enough information. The health insurance companies as well do not have enough information, which is why they just charge a flat rate based on age and other general criteria, as opposed to based on health conditions, which the health insurance companies do not know and cannot know because it's sensitive information. But the next imperfection in the healthcare market is what we call moral hazard. So basically, this is when the insurance company or even like the third parties, where you're able to go on your website and check the different services that are available, the different healthcare providers, the different health insurance companies and their cost. What that does is that it helps to bridge that information asymmetry gap, and then you're able to go with the health insurance company that is most affordable to you, right? So therefore, you're saving some cost, right? So that helps save cost. And a disadvantage of that is it leads to moral hazard, whereby because you got something for a cheap amount, then you begin to misuse it or overuse it. A good example of that is, for instance, you got healthcare services cheap. I mean, you only got to pay $25, for instance, as a copay for each doctor visit. And so because of that, any slight pain or any slight discomfort you feel in your body, you go to the hospital. Now you're abusing it, right? Or because you got a house insurance, for instance, if you get very careless and reckless and then you leave the stovetop on, right, overnight, that could cause a fire hazard, right? So people tend to become careless when they know that they have affordable health insurance. So one way that the health insurance companies try to limit moral hazard is by ensuring a copay, right? So for each doctor visit, rather than having it free or rather than paying $5, you got to pay something that is valuable to you, right? So if you got to pay like $25, $30, $50 per visit to the healthcare provider, then you'd probably be more cautious and more intentional about taking better care of your health and trying to reduce the doctor visits. Another thing that health insurance companies do is to have strict rules about covering certain treatments or certain medications. So for some very specialized and expensive medications and treatments, they might not cover it as much, right? So that is just a caution for us to take better care of our health and not to overuse affordable healthcare services. Okay, so now let's take another example. Before we take this example, I just want to emphasize that adverse selection is a concept that still stems from information asymmetry. In other words, when the health insurance companies cannot distinguish who has a higher risk of, a particular disease, and so then they give a flat rate, right? So that is called adverse selection, where they cannot distinguish different fees for different kind of, patients, right? Okay, so now this is an example about that. So assuming we have 5 swimmers with 20% risk of getting an injury, and it costs $15,000 to treat the injury per person, right? Okay, so how much will be the total healthcare bill on a yearly basis? First of all, there's 20% probability, right? So 20% times, how many people do we have? We have 5 swimmers, right? So that means it's simply one person or one swimmer that is at risk of getting this injury. And if it is one swimmer that is at risk of getting this injury, it costs $15,000 per treatment, right? So this is equivalent to $15,000 on a yearly basis, okay? Now, how much should each person contribute? Because there are 5 swimmers in total, all you need to do is split the $15,000 yearly premium divided by 5 people. So that is going to give $3,000 per person. So each person is better off paying $3,000 a year just to protect from this low risk but high cost events. Now, let's quickly go on to the next example. How about we talked about people having different health conditions, pre-existing conditions, which the health insurance companies cannot distinguish, right? So, assuming out of these 5 swimmers, 3 swimmers have a low risk, so 10% injury risk, but 2 of the swimmers have a higher risk of getting injured, so 40% risk, right? So, in that case, how much would the healthcare bill end up being? So you have 10% injury risk, right? 10% times the total cost of treating the injury, 15,000, which is going to give you 1,500 per person. And because there are 3 swimmers with this 10% probability, so that is going to translate into 1,500 times 3. That's going to translate into 4,500 for 3 swimmers with the low risk. How about for the 2 swimmers with a high risk? You have 40%. 40% of $15,000, that's going to give you $6,000. You see how that's really high? $6,000 per person. But how many people have this high risk? 2 swimmers. So multiplied by 2, that's going to give you $12,000 for 2 swimmers. So that's going to give a total bill of $16,500 for the 5 people, if the insurance company was able to distinguish between who has a lower risk and who has a higher risk. So if you split this $16,500 divided by 5, then that means each person would end up paying $3,300 per person. Okay, so you see how when they couldn't distinguish between those who have a lower risk and those who have a higher risk, it was just $3,000 yearly per person, right, for the insurance fee. But now that you can distinguish, there's a higher risk, right, for some people, so the insurance premium has increased, right, and now it's $3,300 per person on a yearly basis. So now the low risk people might decide to opt out, and if they decide to opt out for a cheaper plan, then that's simply going to increase the total premium for those left in this insurance plan. So for instance, if one person opts out from here, right, so instead we now have only 2 swimmers, right, with a 10% risk, then what that happens is that this is going to reduce from 4,500 to 3,000. And if this reduces to 3,000 for 2 swimmers, then the total is going to come down to 15,000, and that 15,000 is going to be divided among 4 people. So that is going to come up to $37,550 per person on a yearly basis. So that just tells you that those who have a higher risk have more incentive to get health insurance than those who have a lower risk, right? But at the same time, it's always safer to get a health insurance to prevent against unforeseen circumstances. So the more the low risk people drop out from this health insurance plan, the more expensive the premium gets per person for everybody in this health insurance plan. So health care is a right, it's a necessity, and it's something that has been experiencing increasing costs, especially in the US. And this high cost of healthcare is mostly driven by increased medical technologies, right? So like the machines that they use in the hospital, the x-ray, all of those equipments are very expensive, and that's the major component of the rising healthcare spending in the United States. So among other developed countries, the US is one of the countries with the highest healthcare expenditure. But this is not without its benefits. It has led to things like increased life expectancy on average, reduced infant mortality. It has led to better sanitation and hygiene in general for the people. And also it has reduced out-of-pocket expenses due to government intervention in likes of Medicare, Medicaid, and even the Veteran Health Administration package. And that is basically it for chapter 12. I hope you found it helpful and I hope you've learned a lot. Don't forget to like, to share, and to subscribe. Hey, you got to share this good news out to your friends who are going to find this information useful. Thank you so much for your support. Till we see you on the next chapter.